my name is Heidi from Finer Beauty. Here I am again. Our topic today is the post-op depression after lipo. It's also called post-op blues, however you want to call it. Most prospective plastic surgery patients fail to consider the emotional impact of the cosmetic surgery. There are positive emotional effects, to be sure, but most people tend to forget about the possible psychological side effects of undergoing major surgery to improve their looks. The post-op depression or post-op blues is a real thing, just like postpartum depression, but its effects can be minimized if patients are mentally prepared for it. Plastic surgeons don't even mention post-surgical depression as one of the risks and complications of surgery. Let's check out some of the contributors to post-surgical depression, which are common to any type of surgery as well. Side effects of general anesthesia. Did you know the remains of the chemical used to put you under and general anesthesia can stay in your body tissues, affecting you both physically and emotionally for up to 3 weeks? These residual effects can give a diversity of symptoms, which seem to increase in proportion depending on the age of the patient. Painkillers. Post-pain management usually requires at least a brief period of the patient being on prescription narcotic painkillers. Most narcotic painkillers are in class of drugs considered depressants. This does not necessarily mean that they will make you depressed. It just means that they tend to slow down the circulation of the blood, much like alcohol, but on a larger scale. Just as people have different emotional reactions after a few drinks, they also have different reactions to being on pain meds. Sometimes these reactions are similar to and compounded by those related to the residual effects of general anesthesia, as I mentioned before. You know, like these people that have like the bad drinking, this could happen also to the people on painkillers. Physical restrictions of the recovery process. Almost no one enjoys being stuck in bed, depending on others for help with their basic tasks, being forced to abandon our usual routines and take time out for healing. Feelings of restlessness, boredom, helplessness, and even uselessness are very common. In addition, the lack of physical activity usually means a short supply of endorphins, which is never a good thing for the mood. Sleeping on your stomach for 2 months to protect the damn BBL? You're used to being independent. Bruised and battered. If you look and feel terrible, you are definitely going to feel terrible emotionally as well. Imagine laying on bed in pain, doped up on medication, which makes you feel nauseous. Then you go to the mirror to a sneak peek. Your body is bruised and swollen. You have stitches, you're pale. Think about it. Hormonal imbalance. I've seen clients who started to lactate after lipo, just like if they get birth. I've seen clients with melasma in the lipo area, just like a melasma from pregnancy, and it goes away after 3 months post-op on its own, just like after the pregnant lady delivers the baby, the melasma goes away on its own. It's the same thing. One of my patients' booty became hairy after the lipo. Some of them experience hair growth, which it'll be a good side effect. Some experience hair loss. The traumatic impact to the body of a liposuction can translate into a hormonal imbalance, which can take place in the body for several weeks. And one of these side effects can be the post-op depression. We will be discussing in another video how to combat the post-op blues. That's it for today. I'll see you in another video next time. Here's my phone number. You can text us. You can inbox us via Instagram or Facebook. Any inquiries you have about the recovery process, the post-op or the pre-op, we are going to be here for you. We will be talking about a lot of tips and recommendations for health, beauty, and wellness. Don't forget to subscribe to our channel and press the bell for the notifications. Thank you.